Hi, Kevin Henry, the Group Editorial Director for Advanced Star, Dental Products Report, and Modern Hygienist, and I'm on a Google Hangout today with my friend Anastasia Turchetta, who is America's Dental Hygienist. How are you today, Anastasia?
Hey Kevin, it's freezing here in Boston. Other than that, I'm doing great. How about you?
Doing well, doing well. I'm staying warm as well with the turtleneck on. So, hey, let's talk a little bit about e-cigarettes. I know that
Mhm.
that's something that is just growing in popularity like crazy, and it's also something that you've been doing some research on for some of the talks that you're giving around the country. Just kind of tell our viewers what you've learned and what they need to know as dental professionals.
Well, I know it's a really hot topic, and I thank you for even bringing this to light, no pun intended. But what I find interesting, and I didn't know either, I thought there would be tobacco in it. So what is very interesting is we're taking a new topic, being the e-cigarette, into a old industry, being the tobacco industry. And there are going to be side effects. Are they in oral health? You know what? The research isn't really out there yet, but I find there's a couple of key things that we as dental professionals should definitely ask. People who smoke or use e-cigarettes probably really don't think that's smoking. So if we're doing like an oral health exam and we're going through their health history, one thing we should definitely ask, you know how it says, are you a smoker? And then especially for oral cancer, we are to ask, has it been within the last 10 years? That's super important. We don't ask that. But now we got to ask the follow-up. Are you using e-cigarettes? Because that's going to make a difference.
And I'm like a lot of people. I don't smoke, and but the one thing I've always heard about e-cigarettes is this is a safer alternative to cigarettes, and you can still smoke, but it's not as bad for you as the regular cigarettes are. So is that something you're finding?
I find both. And I wish I could tell you one way or the other. It depends on what you read. You're going to read some articles with proof there is no health risk at all. Then you're going to read articles where it says, of course there's a health risk, you have nicotine in it, which, let me see here, it's the stuff that is used in antifreeze, and I wish I could find it off the top of my head. And I'm thinking, okay, if this is a vapor and they're vaporizing nicotine, and then some of that form in the vapor is literally made from antifreeze, how are we ingesting that into our body? How's that get into the bloodstream? Because we as clinicians want to know this. Well, ironically, if you take cigarettes, the tobacco, it would get into the nicotine and everything and through the bloodstream through our lungs. Now with the e-cigarette, guess where it goes? It hits the bloodstream, our buccal mucosa, which I feel you don't think there's going to be a side effect in a few years for those at risk. And that's where I think the discussion really needs to come across. The other thing too is, many hygienists will be out there if you see somebody who chews on a pen or someone that's got something in their mouth that could be an oral piercing. These come in like a million sizes and a million different weights. Some patients of mine have said like it's heavy on their lip. So we might start seeing, I'm going to say, either recession from a repetitive placement. I mean, there's different things we're going to have to think about, let alone the health risks for oral cancer or any other thing.
In the first question you mentioned the health history and asking them if they're a smoker and things like that. So let's say I'm a patient, I come into your practice and I say, well, I don't smoke, but I use e-cigarettes. What do you think are some of the points that the hygienist or the dental professional really needs to get out there to me about that?
One of the points, well, probably about three major points, and that first is understanding whether, do they know that it hits the bloodstream through their cheeks, the buccal mucosa. So I would educate them more on noticing, is there inflammation, is there chafing, of the skin around there, because I'm not going to see it unless maybe every 3 to 6 months. I would encourage them to look more like around their lip. Is there anything that's unusual due to placement from one of those things? You're talking a vapor, but still, vapors have chemicals, and just like with smoking, those vapors affect, extraorally as what sometimes they do intraorally. So I would go through the same risk factors, but I don't think people really get that. And in addition, I'm going to take that conversation with teens and young kids and teens. The reason for that, there's no tobacco in these, Kevin, so they can sell them to your daughter. And she
Sure.
doesn't have to provide an ID. There's no regulation at all, so no tobacco. They can go in and use these, and everybody thinks it's really safe. When in actuality, the research just isn't out there to prove 100% either way.
So if I'm a dental practice and I'm updating my health history forms, now might be the perfect time to add in that whole smoking little narrative about e-cigarettes, and that would be a good
Yeah.
tip as well, right?
Absolutely. I think you've got to look at the individual, and have that discussion. What other health risks are they at? So if they already have gum disease and this is a vapor and it's got antifreeze within it, I would, encourage them, okay, is there another way? Why are you using this? If you're using this to quit smoking, is there another way? Because there was one research article that said really e-cigarettes is about the same as the patch for some people to quit smoking, which I applaud. I think that's great. But let's address it from all angles and include, does the patient already have dry mouth? Is it going to be more staining? Are they going to have more recession from where they place the vaporizer, if you will? Different things like that, let alone the oral cancer risk. For me, that's pretty big.
Some good stuff to keep in mind, Anastasia. I really appreciate it. And where can people get a hold of you if they want some more information or want to talk to you more about the hazards of e-cigarettes?
Well, they can find me on YouTube, Twitter, and Facebook right now at Anastasia RDH.
Sounds good. Hey, thanks for your time, and have a great time in Boston.
Thank you, Kevin.